Thank you for your kind introduction. Good afternoon, everyone. First of all, I want to express my sincere gratitude for inviting me to speak at this conference. Today, my talk is integrating quality and patient safety into resident education during radiology training. As a training director in the field of radiology, I was deeply impressed by the saying, medical education is like passing the torch. This metaphor holds significant meaning in the context of medical education, emphasizing the importance of safely transferring knowledge to the next generation, which includes the training of residents. The primary goal of medical education is to prepare physicians who can deliver high-quality care encompassing safety, effectiveness, timeliness, efficiency, and equity, all without the need for continuous supervision. The critical aspect here is the ability to function without ongoing supervision. Over the past few decades, many countries, including the United States, have witnessed the transformation in medical education and residency training. In Korea, similar changes are taking place. Traditional quantitative-focused training methods are no longer deemed sufficient for producing modern specialists in light of demands of contemporary society. Consequently, efforts are being made to transition to competency-based training with milestone and interruptible professional activity, EPA. One significant factor that has accelerated this transition is the reduction of training hours from 2060 onwards due to trainees' law, which limited training to 8 hours per week. The reasoning behind this specific number, 80 hours per week, remains unclear. I don't know why 80 hours per week. This study investigates how this reduction in training hours affects patient safety, resident well-being, and education. The conclusion highlighted focusing on duty hours alone has not resulted in improvement in patient care or resident well-being. Furthermore, added duty hour restriction appear to have an unintended negative impact on resident education. Despite this, trainees' law has been implemented, and now training time reduction to 8 hours to 69 has been discussed now. I think it is undeniably a serious condition. In the context of limited training hours, it becomes essential to maintain the quality of training effectively. This necessitates a well-structured training curriculum. In Korea, a structured training curriculum project was initiated by the government and the Korean Hospital Association in 2020. The key point of this project is the establishment of competency-centered, outcome-based training program with quality and patient safety. Korean Society of Radiology also participated in this project, and known as the Korean Radiology Competency Education Project, namely RCEP. This project took place from July 2021 to December 2021 and includes 6 tasks, with the key focus on creating competency assessment guidelines and developing e-portfolios. There are 4 core competencies proposed in RCEP. Is number 1, image interpretation, ultrasound skill, proceduring competency, and overall professional attitude. Additionally, 12 EPAs were formulated as follows. These EPAs were adapted from international sources to suit the Korean healthcare context. As a reference, the EPAs introduced by the United States in 2016 are as follows: 10 things radiologists do. Next, I will explain the assessment guideline presented by ICEP. To ensure safe, effective, and patient-centered care, two parameters were employed. The first is appropriate supervision, which refers to requirement level of intervention needed to ensure care quality. It's an EPA concept. The second parameter is the training level of performance. It's the milestone concept. The radiology milestones published by ACGME provide detailed description of competencies and assessment guidelines necessary for radiology training. Let me show some cases. For example, in case of image interpretation, 5 levels of training performance are described as like level 1 to level 5. Let's move on EPAs. EPAs emerging in 2005. EPAs represent unique professional work. In other words, a task that a physician performs daily in the clinical environment. For radiologists, it could be a writing imaging report, performing ultrasound, or interventional procedure. This concept differs from competency, which signifies ability to perform, while EPA is a concept of deliverable. EPA assessment in conjunction with milestone assessment. This is assessment tool with EPA's milestone in ICEP. The upper section pertains to milestone concepts, while the lower section deals with the EPA concepts. These levels are categorized, lower categorized as non-deliverable, intermediate degrees deliverable under supervision, and the last upper levels is fully deliverable. This assessment is carried out by supervising physicians collaboratively. Next, I'd like to some essential components in radiology training integrating quality and patient safety. The first, well-structured curriculum is very essential, and it covers patient care, imaging interpretation, safety protocols. For supervised learning, residents should have ample opportunity for supervised learning. Experienced radiologists guide them through the interpretation of complex cases. Emphasis on quality interpretation is also important. Focus on quality interpretation reduces errors and ensures that patients receive appropriate care based on accurate diagnosis. Number 4 is communication skills. Effective communication is crucial in radiology to convey findings clearly to referring physicians and other healthcare professionals, as previously lectures noted. Residents should be trained in conveying complex information accurately. And number 5 is patient-centered care. Residents should be educated about the importance of patient-centered care. It involves understanding the patient's medical history, concerns, and collaborating with other specialists to provide comprehensive care. As you know, continuous learning and feedback is essential. Regular assessment, feedback from mentors, and the opportunities for self-assessment help residents identify areas for improvement and refine the skills. Number 7 is adherence to safety protocols. Radiology residents, including radiologists, must be trained in and consistently follow safety protocol, as previous lecture says, when performing imaging procedure. This includes knowledge of radiation safety, contrast administration, is the wrong line, and infection control to ensure patient safety. Number 5, awareness limitation is also important. It is important for residents, including radiologists, to understand their limitation and know when seek guidance from experienced radiologists or consult with a specialist for complex cases. Ethical consideration is also important. Radiology training should incorporate ethical consideration related to patient privacy, informed consent, and the responsible use of imaging resources, including artificial intelligence. The last is technology and advancement. Residents should be kept up to date with the latest technological advancements in radiology, as well as any changes in guideline and best practice. Conclusions. Radiology resident training plays a critical role in ensuring quality and patient safety. A comprehensive training program that covers accurate interpretation, effective communication, safety protocols, and continuous improvement will contribute to producing skilled radiologists who can provide the best possible care to patients. Thank you all for your attention and time today.